I often hear people ask me, why me? And that is a question that I find very difficult to answer. Every patient has a story behind. And who am I to answer that question? This man who has 2 young children asked me a question, will he get to live to see his children get married? And why must it be him? The young, the old, and even the not so old, they ask the same question. What have I done in life that it has to be me? Then I will release 413, 414, and also 407. Yep. Okay? Yep. In 1998, I was the first nurse clinician for palliative care in Singapore. In 1997, I was working in a surgical unit. I noticed that there were these 2 palliative care doctors. They were very gentle. They took a chair to sit down with the patient and talk to the patient. And to me, that was amazing because most of the surgeons would not have that time. These 2 doctors, they were very different. They bothered to listen and they took time to listen to the patient. They were doctors, they were social workers, and I wonder where the nurse is. That's when my interest for palliative care started. Hi Kathy, this is for you. This one is the sensory apron. You see this one? Okay. Okay, like that. Okay, like that. Okay. Yeah, slowly walk. Okay. Yeah. Okay, now the other hand, right hand put here. Okay. You okay, Kathy? Yeah. You alright, yeah? Okay. Yeah. After a while, when you look at it, it is very calming. Yeah. And then you just follow it, help you to focus. In the acute hospital, usually nurses focus on patients' recovery, making sure that patients are well enough to go home. But in palliative care nurses are quite different. The patients who come to our hospice, most of them have life-limiting illnesses, and many of them would actually pass on in our hospice. We are looking at providing the patient quality of life. Oh, this one also changed. This one is orange now. So restless already. Now after a while, sometimes we bring the patient into the sensory room. We have the bubble tube and the fiber optic lightings as well. It's quite fun, For some patients, we have noticed that when they listen to the sound of the water and the bubble, that seems to help them to be more at peace. Morning, Mr. Tu. Okay. You lift up your leg. Yeah. At that time, when I started off, there was no role model for me. I over-identified myself with the patients or the family members. There were times that I cried. I cannot cry in front of the patient. I cannot cry in front of the family members. So I can only cry when I'm with my team. Many people think that, nurses only deal with physical symptoms. But nurses do more than that. About 10:30. In palliative care, we take an interdisciplinary approach. And sometimes when the patients or the families bring up issues like psychological concerns that they have, the nurses can also attend to them. We will listen to the patients and the families, and we will be the one that sometimes be the advocate for our patients. So we just be clear about that. Yeah, okay. For us to be able to care for your father, we will need a bit more information. Has he mentioned about his preferred place of death? Palliative care is not just about the patient. When a terminal illness struck a patient, it will affect the family members. When caring for a palliative care patient, we will go the additional mile to care for their loved ones as well, and we watch out for them. It's because patients will pass on, but their loved ones, the family members, they will continue to carry on living. My first death in the family is when I was in Australia. I received a call from my brother that my father was unwell. Immediately I flew back. Within 2 weeks, the diagnosis of cancer of the lung was confirmed. We were devastated at that time because the doctor told us that his prognosis is very poor. He only had 1 week to live. Then I try to recall what my patient family did or what I have done to help them, So we planned to bring him home. My father called all of us to give his last words. Words that are being spoken at the deathbed is so powerful, and you will remember it for many years. And the next day, he passed on peacefully on his bed. And to me, that was really good death for him. It was so wonderful, surrounded by family members. Happiness is waking up in the morning and being able to see my husband sleeping beside me. It's about taking time to be with my family members, having dinner with them. Happiness is about going to work and wanting to do my best, like bringing a smile to a patient's face or even bringing a smile to my colleagues. Yes. Happiness is about being content with what I have. That is what happiness is about.